Hi, I'm Tom Cornelison. I was the first patient to use the Mako robot for my knee replacement at Essentia Health. I like hunting, fishing, boating, and just being with family, spending time up at the cabin, relaxing and enjoying life. Working for the 148th Fighter Wing, being an aircraft mechanic. As far as the knee issue goes, there's a lot of squatting, there's a lot of up and down on the airplanes, jumping off of wings, and when you're maintaining the aircraft. Yeah, the things I'd love to do were limited tremendously. Working out in the woods, couldn't do that. I'd come back and I'd suffer for a half a day trying to get the pain away, and it limited me so bad that it was very frustrating.
He began seeing Dr. Jay Butcher, one of my non-surgical partners, for his knee, and went through the entire gamut of non-surgical care for his knee, which turned out to be severely osteoarthritic. So once he had failed all the conservative measures that Dr. Butcher had at his disposal, Dr. Butcher asked me to see Tom for consideration of knee replacement. However, at the time that I did his first knee, we didn't have Mako. We didn't have a robotic-assisted surgical procedure. I did manual instrumentation, and I think it's fair to say that Tom struggled a bit with his first operation.
It was stiffer than what I thought it should be. I do the exercises and I couldn't get the range of motion that I would like and what they would like.
When he came to see me at the 1 month mark, he was only bending his knee to about 90 degrees. We had to put him through additional therapy because we really want people to get to around 120 degrees of bending by the time they're through their course of therapy.
I worked hard at it, and went till about ready to cry.
The robotic procedure came around at Essentia through a generous donation from the Essentia Foundation right about the time Tom was getting ready to consider his second knee. The Mako robot allows us to do very accurate hip and knee replacements for our patients. And the way that it works is it really combines computer technology with advanced imaging and the surgeon's skill to allow us to make very precise bone cuts for preparation of hip and knee replacements, get very precise placement of hip and knee implants, and all of those things are what contribute to long-term success.
Sherry called me and said that there was this opportunity, and I hesitated for maybe a minute, and I said, "You bet." But I said, my only requirement is I want to be first, be the pioneer, I guess.
We talked about the complexity of his knee deformity and the fact that I, as a surgeon, could probably have much better information about how to fix his knee by using the robotic information and robotic guidance. So we did his second knee using the robot, and the difference was remarkable.
The range of motion was unbelievable to start with. It definitely made a huge difference. There was less bruising, less bleeding.
It was very gratifying for me personally to watch Tom go through the second operation, to see this come to fruition with a patient actually having a much better quality of life and a much better outcome is really gratifying.
By next summer, we can go for long walks in the woods with the dogs that we like to do. We can go fishing again, and we can just move.
The difference is unbelievable. A huge thank you to the team, because they gave me my life back. I can see we're not too far down the road. I can go back to putting up wood, working my deer stands, and enjoying my family. So it's a blessing.